Hi, everybody, and welcome back to Brightside Babe. I'm so excited for episode 2, where we're going to get into survivorship. So, welcome to episode 2. I survived. Now, what the fuck? Because honestly, that is a lot of what survivorship feels like. So, I wanted to kind of talk about beating cancer, which I got into in episode 1, but I really feel that not enough people talk about what happens after everyone stops asking you how you're doing. Apparently, when you finish cancer treatment, you don't get a certificate or a trophy that says, "Congratulations, you are now emotionally stable and completely normal again." Weird. So welcome back, babes. Just a quick recap of episode 1. We talked a lot about why I decided to call it Brightside Babe and what that means. We talked about the dark side, and kind of being able to sit in the dark side when you need to, and then what you can kind of expect. So we talked about getting through the shit. Today we're talking about what happens when the shit is technically over. So survivorship, it's a very weird kind of world. I think about when treatment ends, and I often think about, I compare it to like a breakup. So when you're going through treatment, you've got this team, you've got this relationship, everything feels stable, meaning like your disease, like you're not worried about recurrence. And then I felt like, for me, I went through chemo, radiation, and a double mastectomy. Radiation was kind of the last part of my traditional treatment. And when I rang that bell, I felt amazing. And then it was kind of over. And so, I felt like I had gone through a breakup. I had all this baggage. I didn't have a bellman to help me carry my baggage or unpack my baggage. And I was kind of left there on the steps of the hotel with all my baggage and not really knowing what to do. There's that immediate aftermath, that euphoria of finally finishing treatment. And I first want to say, if you have recently finished treatment, if you have recently overcome a trauma, a hurdle, something major, you need to celebrate that. And that was something that I had no problem doing. And my mom was wonderful enough to pay for a trip for my sister and I and her to go to Sedona, Arizona, which was wonderful. It's a beautiful place, very spiritual, very unique experience, just beautiful landscape. I would highly recommend it. But yeah, I think just after you finish, you have to take a moment to celebrate. And again, that doesn't have to be a trip. It doesn't have to be anything big. Just find a way to celebrate the fact that you overcame it, because that's super important. And then once you get through that celebratory phase, you'll be on the steps of the hotel without anyone to help you with your baggage. Because it's very kind of a shock to the system, to be done with treatment. I think too, like, you go from having your life completely planned, like having a personal assistant. I know for me, when I was going through treatment, everything was sort of like around the appointment. So I started with chemotherapy. So my planning was all based on these appointments. So I would get my chemotherapy on a Friday. I knew I had to kind of take the weekend to recover. So all of my life was built around that and was very structured. When I had my surgery, my double mastectomy, my life was based around these drains hanging out of me and just recovering. I remember when I went through my double mastectomy, um, I had multiple drains, and that was, gross. I had home health aides kind of coming in to just make sure that my recovery was going well, to help me with my drains, to help me with kind of the wound care pieces that were involved. And that was just a weird time. I remember, like, because at that point I had to take a pretty significant amount of time off of work. But I really kind of, you don't want to leave the house because, again, you have drains hanging out of you. I probably should have left the house more. But instead, I went down the rabbit hole of the show ER, the original ER with George Clooney, the original McDreamy. And I fell hard. Like, I fell hard for ER and literally would watch it like from the moment I woke up to the moment I went to bed, which was probably unhealthy. But God love my mom. I do love you, Mom. She called me and she's like, I think we should get out of the house, because everything with my mom when we went through cancer treatment was like a we. And she did. She like went to every appointment with me. But she's like, let's go to the mall. I was like, the last fucking thing I would want to do right now is go to the mall. I have 2 drains hanging out of me. I'm bald. I feel like shit. Like, what am I going to do at the mall? Try on clothes? Like, no. And again, like, trying to be super helpful. So I was like, if you want to hang out with me, you can come over and you can watch ER. And she was like, oh my God, yes, I'm there. I love ER. So anyway, like, then after my double mastectomy, I had my radiation. I finished that. And then, yeah, like, I was set free. Like, the best way I can compare it is at like a caterpillar, right? They form into a chrysalis or whatever it's called. This came to mind too because my son just like at school, they just did this, and then this beautiful butterfly was born. Like, if I'm the butterfly and after treatment I was born, I wasn't exactly flying free, but you're in this during treatment. You're in this like cocoon of, safety. You're surrounded by doctors. You feel very supported. People are checking in on you all the time. And then you come out as this butterfly on the other side, and there's no longer that community. And that's because like everybody goes back to their lives. And that's what it should be, right? But you are kind of in this new life because your life as you knew it was cancer. It was defined by cancer. It was defined by these appointments. And so first and foremost, I just want to emphasize that it's okay to, and it's funny, I was like talking to another survivor recently, and she was like, I know like that everybody has to go back to their life, but I kind of don't want them to. Like, I still need support. I still need a lot of things. And, it's okay to feel that way. It's okay to still ask for help because, like, you're still in it. Like, I don't really care what people say. Like, when I think about when I was done with treatment, it was very surreal because, like, for all intent and purposes, on the outside, like, I looked like a sick person. I was bald. I remember like going through treatment and I was like, oh, I'm so amazing. Like, I lost all the hair on my body, but I managed to keep my eyelashes and my eyebrows. Well, I shouldn't have fucking said that because like after my last treatment, half my eyebrows fell out and pretty much all my eyelashes. So it wasn't enough to be fucking bald. I had to have half an eyebrow and some eyelashes. So, of course, like the first thing I did when I finished up treatment is I was like, I'm going to treat myself to some eyelash extensions. Like, that'll fix it. And by that time, like some of my hair had grown back, not much. Some of my eyelashes had grown back, again, not much. So I went to this lady and I think she was just like trying to be really helpful and she gave me a really good deal. But if you don't know anything about eyelash extensions, which is okay if you don't, they have to actually attach them to your lashes. And because I had very few, I realized she gave me a deal because like she was able to attach like not that many lashes. Needless to say, like it didn't really change the picture, but it did make me feel more pretty temporarily. And then they quickly fell out because, again, I had no lashes to begin with. So my point being is your body is not there. Like even though I had the new tatas, which were great, it was tough. It was tough for me to look in the mirror and like be like, okay, time to, be like how Stella got her groove back. Like that was just a weird time because, you are a different person inside and outside and, you still look sick. And so it's hard to like, mind over matter, like when what you're seeing is kind of still this sick person. So I think just like one foot in front of the other, you don't have to like all of a sudden be healed and feel great and feel like you have to just all of a sudden start your life again because it's going to take time and there's a lot that is going to need to happen before you get there. I think survivorship, the other piece of this, right, is, of course, this like fear of recurrence. And for me, that like started immediately. Like when I stopped radiation, and again, I think like each journey is different. Each cancer is different. I was talking to somebody the other day that had esophageal cancer, and they're being followed much more closely because that's just the nature of the differences in disease and cancers and protocols. And she was getting scans like every 3 months. And like I found myself being envious. And let me explain why, because I know that sounds fucking weird. So they have something called scanxiety. So not anxiety, which we also all have, but scanxiety, where, you're getting these follow-up scans. And for anybody that's been through it, like, that after a scan, before a scan, like there is so much angst and just your life depends on those scans, right? Your life can change dramatically based on the results of those scans. Well, for breast cancer, at least for the type that I had, because I had a double mastectomy, I wasn't being followed by mammograms because I had fake boobs. And it's pretty rare that a recurrence will occur in a fake breast. Certainly, there could be local recurrence in other areas, but honestly, for me, like, and I was told this by my oncologist, she's like, if you're going to recur, you're likely going to recur and it's going to be metastatic. I was like, great. Thanks for the pep talk. So I didn't have scanxiety. That's hard to say. I had scan envy and like, I just wanted to be scanned. And because this is what's going to happen. And if this is what you're going through, if this is what you went through, like this is all like quote unquote normal. But I would get like a headache and I was like, well, of course, like I have brain mets. That's why I have a headache. Or like my back would hurt and I would automatically be like, oh God, like I have disease in my spine or I have bone mets. Like the list went on and on. And so I will say, like, my care team, I think they were being hyper conscious of supporting me. And also, like, that's a real thing, right? Like, breast cancer most often spreads to the bones, the lungs, the brain. But not typically when you're like a week out of like treatment and a week into survivorship. So at first, like, and I didn't care what scan. It's kind of like when you're dating, like first dating, you throw a wide net. Like I was like, I could be into an X-ray, but I could be really into a CT scan and an MRI. Like, damn, yes, an MRI I would love. And that's because I needed that reassurance and I needed that, like, to feel good about myself, right? Like when you're first dating, you kind of need that. You got to find your type. And yeah, like quickly my care team was like, okay, like there's clearly some psychological things going on and a lot of this is in your head. Now, they did not say it to me like that, but I could read between the lines. So my advice here, and I would say like my most recent instance of this was I was having some shortness of breath, which I do get. I am more prone to respiratory infections. I do have some scarring on my right lung from radiation, which that can happen. And so the doctor appropriately ordered a CT of the chest. And there was an incidental finding, like it was otherwise fine, but there was an incidental finding of a small nodule on my lung, which of course, like to me, the world was ending. And that can be actually like really normal. And this is the problem with getting scanned on a whim and because you're, having a headache or a backache. There is always going to be incidental findings. And if all of us were scanned regularly, like you could very well have an incidental finding. And one of those common findings is small lung nodules. And my team like wasn't worried about it, but of course, like I went down, like I started basically a love affair, and I'm sorry, honey, I love my husband more than anything, but I had an affair with ChatGPT and I love you so much. Please forgive me. But I went down the rabbit hole of ChatGPT. And we all know like ChatGPT is amazing, but I think like we had an unhealthy relationship. It was a little obsessive, a little controlling on my end, and just we were moving really fast. And by that, I mean like I spent the weekend like putting in my scan, putting in my symptoms, and was just like working myself up, both literally, physically, emotionally. And my care team like continuously said, we are not worried about this. This can be common. I had also just had COVID. So these kind of benign nodules can show up in your lungs, and not just on cancer survivors, like on anybody when you've had an infection. So I also had recently had an infection, and they also kept saying that. And I think like, so my advice, take it or leave it, because like if you're also, falling into a relationship with ChatGPT and obsessively doing things, like you kind of have to go through it, but you also have to listen to the professionals. And I want to say this, just in case like my oncology team is listening to this, which I highly doubt. They're pretty busy. They are the professionals. they are the experts, and they will tell you if they are worried about something. Now, I also want to defend my point of view at the time, which is when I was first diagnosed, and if you listen to episode 1, you know this, I presented not in the most traditional way. So typically, breast cancer does not cause pain. And that was one of my major symptoms. And so I always go back to that. I also was told, and again, I was not told this, like, I think we sometimes hear what we want to hear. I was told that it could be a fibroid based on the pain that I was having. And so, of course, in my mind, I was like, well, yeah, I've heard this before. Like, you told me it was a fibroid and that it was likely that. That's like not what they said. They said like a bunch of things, and that fibroid was a possibility. So I feel like I always go back to that, and I have this kind of mindset of like, well, yeah, I've heard this before, but, you know, I also know that it can be a lot of other things. That's like always going to be the case, right? Like, but the medical professionals are there to guide you, and they see a lot more than we do. Like, we have our own experience. We can talk to people that have gone through cancer, but the medical professionals, the oncologists, like, they've seen it all, and we have to trust them. So I know it's hard, and I know that we'd rather be in a relationship with ChatGPT, but we have to trust our team. And so when I went back and had my CT scan to follow up on this nodule, because that's proper protocol, if a radiologist calls something out, like, they have to order follow-up, typically the first scan being within 3 months. I had my scan, and because my team knows that I'm hyper anxious and a little bit crazy, I love my team. This lovely NP was like, you know what? Like, you'll get the scan in the morning. I will request a wet read, which, if you don't know what that is, it's basically asking the radiologist to look at it and just do in a very kind of initial cursory read. It's not a full report, but it can kind of, you know, they can kind of look at the images and kind of just tell the provider, okay, this is my initial reading. So she did that for me, which was super nice. I like to say, because she knows I'm really special. But really it's that she knows, otherwise I'll be like constantly checking my patient portal, constantly like messaging. So really it saved her a lot of work on the front end, or on the back end. So anyway, I saw her and she was like, okay, yep, I'll schedule time. You'll get the scan. Then again, I'll talk to the radiologist, and that way, like, you can leave with answers, good or bad. So not surprising to her, but of course to me, because again, I had been talking to ChatGPT and they had said something different. My nodule had actually shrunk in half, and I was like, it's a miracle. Like, oh my God. And I was like ready to cry. And she's like, why were you so anxious about this? Nobody with a medical license was. Like, why were you so anxious? And I had to really like take a step back, because I was like, is this like how I'm going to live my life? Like, it's unhealthy. I wasted multiple days, like, and actually I'm being kind to myself by saying days. It was actually like months. So worried about this, so obsessed about this. Like, I realized, like, this is an unhealthy, like, train of thought. Is it justifiable? Yes. Like, but I just want to say to you guys, it's no way to live. And that was like a really kind of clairvoyant moment for me, where I was like, I have to change my way of thinking, and I have to trust my team, because they know what they're doing. They know what cancer looks like. And if they tell me not to worry about it, I need to listen. And until there's something to worry about, that's kind of the way I need to start thinking about things. Now, I said that like super confidently, and it was a very like clairvoyant moment. It doesn't mean that that's going to change tomorrow. It just means that I acknowledge and recognize that I'm having this obsessive thinking and I probably need some professional help. So how did I go about that? Like, what did I do? Well, first and foremost is, I've been journaling, and I do write down kind of my thought process in these moments so that I can go back and reread my rantings, but also like in all seriousness to kind of see my progress. And this was one of those moments that I had to journal because it's important. And it also made me realize like I need to change my thinking. I need to be more present in my life. I need to be more present for my husband and my son. And like I'm missing it. I'm missing all the things because I'm obsessed with something that's not even a thing. And so we have to be able to pull ourselves out of it. And so I'm just encouraging you all to pay attention to that, because that kind of thinking, that obsessive thinking, that we're not living our lives, we're not surviving, we're just on a hamster wheel. So just think about that. Now, some of the things that have helped me, so there's of course like therapy, and there's a million different kinds of therapy. There's talk therapy, there's a lot. And it can be hard. I will say that I've done talk therapy. I've had really good therapists. I've had not so good therapists. And by not so good, I just mean that it wasn't a fit for me. I will tell you a funny story about one of my therapists. And I want to say this because therapy, it's like when people say you've got to kiss a lot of frogs before you find your prince. Yeah, sometimes you have to kiss a lot of therapists, but like not literally, because most of the time now therapy is remote, but also like kissing your therapist is probably gonna lead to you needing a lot more therapy. And probably they're the wrong therapist. So I met with one therapist and, we had like our first date, and your first date in therapy is kind of like first dates in general. They're usually awkward. Like you're both trying to find your footing. You're being asked a lot of questions. It's okay. But yeah, I mean, in therapy, the first session is always like intake, right? So you're being asked to divulge like everything about yourself, answer all the questions. It's tiring. Like I remember after the first session, I was like, I'm exhausted, like stuff that, and then my second session, and I was very clear because like I had therapists prior to this where like I would just talk and it was like a stream of consciousness. I already like know my perspective. I know the way I think. I know my unhealthy thinking. Like I know like kind of how I respond to trauma. What I need in a therapist is, and if this helps you, great. If not, that's great too. What I need in a therapist is somebody that is going to listen, of course, but also kind of take what I'm saying and help me gain a new perspective, right? Help me kind of change some of my thinking, like not completely, but kind of help me find a more healthy perspective, a different way of thinking, different way to manage, and tips and tools for how to kind of manage panic attacks and anxiety and insomnia, like all the things I was kind of dealing with. So this therapist, because in the first session, probably the most fresh trauma was my breast cancer. So I kind of started talking about it, and I probably said like 2 or 3 things. Well, guess what, guys? She happened to be a survivor. So she was a bright side babe. So, if she's listening, please, I hope you subscribe. I hope you follow. But she was a breast cancer survivor and proceeded to, and I am not making this up, I tend to exaggerate sometimes, but I'm not exaggerating about this. She talked about her journey in breast cancer for about 30 minutes. And I, of course, listened. Like, I actually enjoy hearing other people's story, which is part of the reason I'm doing this. And I want to be a sounding board, and I want to help other survivors. But not when I'm in therapy. Like, if I'm paying you, I don't want to hear about everything you went through for 30 minutes because I basically felt like I was a therapist. So, yeah, after that meeting, I gave it one more chance, and it just didn't own best advocate because nobody else is going to advocate for you like you. I don't care what anybody says. Sometimes you do need other people to advocate for you, like when you're having an anaphylactic reaction to Taxol. Like, yeah, other people need to step in. But you have to, nobody knows you better than you know yourself. And I know sometimes it can not feel that way, but I promise you've got to trust yourself and your instinct. So I did provide her that feedback. I think she heard me. But my point of telling you this is that, I don't want you to not explore therapy if you have a bad first experience. Because, as I said, sometimes you gotta kiss some frogs and to get to your prince or your princess. So I ended up finding somebody that was great after this. And, you've got to also, like, another helpful thing, and I wish I had done this kind of in the beginning, but is really kind of make a list of what you're looking for in a therapist and what are your struggles and what are you looking to get out of it. And that can be really helpful too for the person that is your therapist to kind of use that as a guide. But yeah, I mean, therapy has been really helpful for me. It's not for everybody, but I think it's not for everybody because I do think sometimes people have that initial frog and then they just give up because they just think like therapy's stupid. This isn't for me. I'm not getting anything out of this. Like anything, you have to put the work in to get something out of it. And so some of that is finding the right person, but then you can't just go for like 2 weeks and be healed because like we're always growing, we're always changing, and therapy can really be an objective sounding board for all the shit that we deal with in life because it's a lot of fucking work to be a human and then be a human that's been through a lot of trauma. It's just like, it's helpful. The other piece that I want to talk about is medication. So I started taking Zoloft after I had my son. I touched on this briefly in the first episode. I dealt with some postpartum. I'll get into that. We are going to do a whole episode about postpartum and pregnancy and all the things. But the Zoloft was a life changer because I got to tell you, sometimes when you go through trauma, it changes your brain chemistry. And so if therapy is working and you're doing great and you're feeling better and you're taking steps forward, that's wonderful. But sometimes we go into the dark side and we can't find the light. And that's okay. And I just want to emphasize this point because I think it is so, so, so important. Please don't let anyone ever tell you that therapy, that taking medication makes you weak, that it makes you crazy, that it is I don't know, all the things. There's so many stigmas around mental health and medication, and it just isn't fair because there's so many people that could benefit that aren't taking it, and then bad things happen. So I did decide to start seeing a psychiatrist because I really wanted somebody that specialized in medication management, because I was I had been on Zoloft, I think for like 3 years at that point, and it just wasn't working for me. And I started having panic attacks. My anxiety was poorly controlled. I was having insomnia, like all the things that can pull you into a dark room without a nightlight. And so I found an amazing psychiatrist, and I need people. I can be a bit of a bullshitter sometimes. And I need somebody that's going to be really direct. And she was really direct with me about Ativan because I have a complicated love affair with Ativan, which is a benzodiazepine. I think that's how you say it, but I just say benzos for short, the street slang. And she was like, you are using something that is used for typically used for short-term use, and you're using it for sleep, which is really not the correct use of this medication. And, you're addicted, which again, addicted doesn't necessarily have to mean that you're, in a back alley smoking crack. Like, addicted can mean a lot of things, and I had been prescribed this. I wasn't, buying it. I was prescribed it when I was going through treatment, which was appropriate. Like, I did need it, and it actually helped a lot with my nausea. It helped with my anxiety at that time. But I became more dependent on it for sleep because, as we've talked about in post-survivorship, it's a really hard and weird time. So, long story short, I met with my psychiatrist. She has completely done a review of everything I'm on and made so many wonderful recommendations. And I'm on a new regimen. And, I'm not completely seeing the effects yet, but I got to tell you, I slept 10 hours last night. Like, I can't remember the last time I slept 10 hours. Like, it was probably in college when, that was like what you did. But I feel very hopeful. And I haven't felt that way in regard to my mental health, in a long time, because if you're having insomnia, if you're not sleeping, everything else is shit. I don't care what people say. And you don't have to get 10 hours. That was a fluke. That's not where I'm, I would have been happy with 6. I was averaging probably 4. But if you are not getting enough sleep, everything else is going to be compounded. So anyway, that is my plug for mental health. I'm not going to go on a complete diatribe about it, but you have to take care of yourself. And if you feel like you cannot get yourself out, you've got to talk to somebody, whether that's your PCP, talk to your therapist who will, refer you, but find somebody to talk to, and do not be afraid or ashamed if medication is something that you need. It does not make you a weak person. It actually makes you a strong person because you're advocating for your mental health. And your mental health, you can't be good for everybody and everything and all the things if you are not good yourself. If you are not taking care of your mental health, the rest of it doesn't matter. We've got to be able to take care of ourselves so that we can effectively and fully live our lives. Now, that's not to say, I'm not saying everybody should be on medication. That's not always the answer. But you know yourself, and you know when you've gotten to a place that you can't get out of. So reach out for help. There is help out there, and there are supports. And yeah. I also, I think I hear a lot from people that I say this like I'm like just talking to survivors all day, every day. I'm not, but I happen to know a lot of people that have gone through cancer and many different kinds because guess what? Cancer is everywhere now. And it's sad to say, but it is. And, I talk to people of all ages, et cetera, that have been through many different experiences. But the one constant that I've heard is A, that it can be a lonely place when you're going through survivorship. But B, it's also kind of an identity crisis because I want to tell you something. You are not exactly the person you were before cancer. And that's okay. So, like, a freeing part of this is, if I want to kind of spin to the bright side, right, is you get to be whoever you want. It's like being reborn. I know that sounds cheesy, but it is. Your priorities change, your relationships change. There are things that just don't matter anymore because guess what? Like you've been to the darkest of the dark and you've overcome it. So some of the shit that was petty and bullshit, like something that's really changed for me is like quality over quantity. Like I have a small circle and a small village and I love it because I don't need like a bunch of friends. I don't need, like, you just need your village. And so on the flip side of that, like I said, you figure out what matters more to you because when you go through any trauma, it's going to, or hopefully it does, right? Like it's going to make you appreciate things that maybe you took for granted before. And then, speaking of being grateful, there is this pressure that like we should just be so grateful all the time. Like we beat this, we survived, we're amazing, which we are. But you don't have to feel that way all the time. It's okay to have days where you feel sad. It's okay to have days where you just feel mad. And it's okay to have days where you just are like, I fucking hate this. Why did this happen to me? Because we're going to still have bad days. Because guess what? Like it doesn't, just because you finish treatment, just because, whatever, like you are still going to be dealing with this for a long time. And so allow yourself to not to feel this pressure of feeling grateful and feeling like, you got a second chance because you fought for that. And so allow yourself to feel like I can be grateful I survived and still be pissed off about what happened to me. That is very natural. So we've talked a lot about a lot of things. And so I want to, and I told you this, when we're going to always end every episode with our dark side and our bright side, like our peak and our pit. So in kind of staying with theme of this episode, I'm going to be a little more existential with my dark side and my bright side. But remember what I said in the first episode. It does not have to be existential. It doesn't have to be big. It could be like, my bright side today is like, I got out and I walked for a mile. Like, good for you. Like that, is progress. Like that is a big deal. Like if you've been feeling tired and going through treatments and like just getting outside and walking a mile, great. Half a mile, great. One jumping jack, fucking awesome. But for me, because I've been thinking so much about this, some of it because like I'm doing this podcast, but also just like I've been doing a lot of deep thinking lately. So my dark side is that cancer stole a version of the life I thought I was going to have. And that is very true. Like, I thought I might have a second baby. Now, I want to be clear, like I was told, like that I could have a second baby. But everything is pros and cons, right? I love a fucking good pros and cons list. So pros, a baby. Cons, I would have had to go off my oral therapy. I would have had to a lot of it was like I'd have to go off of medication that has been shown to reduce the risk of recurrence. I also just, my body had been through a lot. So like my husband and I had to talk a lot about that and had to make some really tough decisions. But you know what? Like I've had to kind of let go of that life. And instead, like I think about like I am so fortunate to have the beautiful son that I have. And like I don't really believe in like, I don't know, but I came to kind of like this conclusion, like this was the path that I was supposed to walk with my fertility, and just like I appreciate him so much, and I just know that like I feel whole, I feel complete. So on that note, like my bright side for today's episode is it made me realize I don't want to spend the life I do have worrying about what and whether everyone else approves of it. And that is like so fucking powerful, you guys. Like to realize that, like live your life for you. Now, it doesn't mean like just be a fucking asshole for no reasons, but there is this like power and freedom that comes with just saying like, I'm going to live my life for me and my family and make decisions. I'm going to do things I want to do and not because like I feel forced. So like take that power back, because that is amazing. And like, I guess for my listeners, one question I'll ask you, and obviously like, I'm not doing this live, but please comment, send me a message. Brightside Babe is on Instagram. I'm on Facebook. I'm on TikTok. But I want to ask listeners, because I know not all of you are cancer survivors, because this podcast is about like overcoming, right? Like doing the hard things, like overcoming trauma, overcoming whatever. But what did life force you to stop giving a fuck about? Because that is very freeing. And for a control freak like me, that has been such a bright side, such a bright point in my life. So, my babes, we are coming to the end. So I want to end with a takeaway, and think about it, take it in, ruminate, talk to your therapist about it. So as we think about survivorship, maybe survivorship isn't about getting back to who you were. Maybe, just maybe. It's about giving yourself permission to become someone completely new. Don't be afraid of that. So I will be back. My goal is to do these twice a week. So Tuesdays and Fridays. And I'm really excited about episode 3. So next time we're going to talk about something nobody prepares you for. And that's the people that showed up, the people who disappeared, the people who said the absolute wrong thing, and the people who surprised the fucking hell out of you, because all of the above, my friends. So I want to wish you all a happy weekend. And until next time, my bright side babes, bye.